So coronary angioplasty refers to a procedure whereby narrowings or restrictions or even blockages in the coronary arteries are treated and relieved. The coronary arteries supply blood to the heart muscle, and patients who have coronary disease can present with symptoms such as angina, chest pain, or breathlessness, or a limitation in their exercise capacity. And they would have had some kind of diagnostic test which would have shown up trouble in the coronary arteries. The angioplasty procedure nowadays, well over 90% are performed via the radial artery, which is a small artery at the wrist, and that is the access site. The procedures are under local anesthetic and sedation, but patients are awake and comfortable, but they're not put to sleep, and that aids both the recovery and the whole experience, both for the patient and for us as the operators. During angioplasty, the wrist artery, as I said, is used as an access point, and then small tubes called catheters are delivered from the wrist up to the heart, and the arteries are imaged, and the narrowings are then negotiated with small wires. Once the wires are through the narrowings, then balloons are used often to open up the narrowings and to relieve obstruction. And then depending on the anatomy and the severity of the disease, we then go on to often put a stent, an intracoronary stent, into the arteries of the heart to restore the artery back to normality and full patency. And that is done in a careful way, whereby the correct size stent is used and the correct length of stent is used to achieve the best possible results. We now know that when doing angioplasty, as well as experience and eyeball assessment, we can complement our procedures by using additional techniques such as ultrasound imaging of the artery from the inside to make sure that the stents are, the stent result is as optimal as possible, because that translates to an excellent or as best as possible long-term results. There are additional new technologies which are used as part of angioplasty, such as shockwave, which is a technology whereby hardened arteries with narrowings are treated with ultrasonic sound waves to break up the hardened calcium and to enable angioplasty to be performed in a more ideal way. We also do use small drills, for instance, similar to what dentists use. Drills are used to open up tough narrowings, and then subsequently the arteries are treated with stents. So there's lots of adjuvant or adjunct technologies that complement the basic angioplasty technique. And these are all available in our practice here at the Harley Street Clinic. So an angioplasty procedure, by definition, is a procedure which involves entering a blood vessel. So it's a vascular procedure. And although the risks are low, they're never zero. And there is a 1 in 500 risk of causing bleeding at the site where we go in. And if that was to happen, because nowadays we use the radial artery as the access point, the severity and extent of bleeding tends to be minor and very manageable. And it's normally managed just with simple pressure, manual pressure, and sort of elevation of the upper limb. Rarer complications with angioplasty would involve damage or a tear to the artery of the heart that we're dealing with. The risk of that is 1 in 1,000 or less. And certainly in my practice, I always insist on having a surgical backup team on standby for every case, because although angioplasty techniques have been refined and the risks are low, there is very, very rarely a situation in which one requires the help of a surgeon for bailout, and that is what we have. However, most of these complications are also manageable with angioplasty techniques, whereby any bleeding is controlled with things like covered stents, and if there's any bleeding around the heart, we can manage that by putting a small drain just underneath the rib cage and draining the blood away from around the heart. So, the risks are low, and on the whole, they're very manageable. And angioplasty is a very safe technique, and it's a very routinely used technique. But we take every precaution to minimize complications, and we have everything in place to deal with any complications should they arise. Yes, I mean, an angioplasty obviously is an invasive procedure, as I explained, to deal with narrowed arteries or blockages in the arteries of the heart. However, it definitely needs to be complemented by lifestyle measures and by managing risk factors for reducing the risk of recurrence or worsening of existing disease that may be there in other arteries. The risk factors that we focus on predominantly are smoking. So certainly we encourage smoking cessation, and patients generally are motivated and tend to, once they've had an angioplasty, that's enough of a wake-up call for them to give up smoking. But there are smoking cessation services and help that we have access to and we can refer patients to. More metabolic type risk factors such as diabetes, or type 2 diabetes in particular, and raised cholesterol are important things to bring under control. And this is by a combination of medications such as statins and lifestyle measures such as improved diet and weight loss and exercise, which will certainly target both diabetes and raised cholesterol. We offer patients, I should say, cardiac rehabilitation classes and services, and in a lot of cases, these are very useful in terms of A, motivation, B, education, and C, forming a framework for patients to adhere to an exercise program. Other risk factors include raised blood pressure, which generally tends to be managed by a combination of reduced salt intake, exercise, weight loss, and medication. And generally speaking, the other risk factor, which is a bit more difficult to deal with, is stress and lifestyle. Sometimes some patients find that, unknown to them, the lifestyle that they've led has been associated with stress or factors which have contributed to their health deterioration. And perhaps that's something that, after an angioplasty, it's an opportunity for reflection, and patients certainly at times have decided to make changes, but either in their work environment or home environment, to try and improve that. So these are the kind of follow-up and changes that we would encourage. All patients are followed up in clinic, either in person or virtually, at least once, to make sure that their symptoms have improved following angioplasty, and to make sure that all these other risk factors and loose ends are being dealt with appropriately.